Hello, I'm Denise Ellsbury. Welcome to Mental Health First Aid. Our guest today is Megan Raupp. She is the registered dietitian for the inpatient program at Linden Oaks Behavioral Health with the eating disorders program. So we're excited to have her here today to talk about eating disorders, help us understand that a little bit more, and what treatment methods are available related to eating disorders. So welcome, Megan. Thanks for being here.
Thanks for having me.
So tell us a little bit about the eating disorders program at Linden Oaks.
So the eating disorders program at Linden Oaks has 3 different levels of care. We have an inpatient facility. It's a 14-bed facility. We also have partial hospitalization and then intensive outpatient programming. So our inpatient program can have adolescents age 12 and up. We could take adults. There is no end age limit. Males and females.
Okay.
Actually, that age range is the same for all 3 programs. So obviously, there's going to be a distinction between necessary level of care. Inpatient is going to be our highest level of care. So, people who need medical refeeding, medical monitoring, if they're doing any sort of med adjustments, anything that just is going to be more intense in terms of treatment.
Sure.
And then our partial hospitalization and IOP, our intensive outpatient hospitalization, those are both 2 of our outpatient programs. So they are 6 days a week. They vary in time. It might be 8 hours a day. It could be 6 hours a day. It could be every other day. It could be every day, just kind of depending on the client's needs.
Okay. All right. And so what are like some of the common goals of a treatment program for eating disorders?
So, obviously there's different eating disorders. It's a spectrum. So someone might be more on the anorexic side. They could be displaying bulimic tendencies. They could be displaying binge eating tendencies.
So just so we're clear, anorexia means like someone who is restricting or not eating.
Yeah, so someone who's going to be restricting their intake. Typically they're going to be underweight. Someone who is displaying bulimic tendencies are usually going to be going through periods of time where they might be restricting their intake, they might be eating regularly, but they might be overeating at times, but they're going to be using some sort of compensatory mechanism to try to manage their weight.
Okay.
And then someone with binge eating disorder is typically going to be someone who is overeating and then not engaging in those compensatory behaviors.
Okay.
So there's always a nutrition kind of piece to their treatment. We want to make sure that we are restoring if they're underweight or maintaining a normal weight. But in terms of other therapeutic goals, eating disorders are a biopsychosocial disorder. So what I mean by that is they are derived from the mind. They affect all physiology in the body, so all biological functioning, and they impact all their social interactions.
Okay.
So relationships with people, their ability to function at school, at work. So in terms of therapeutic goals, we have to kind of address all 3 of those things.
So it's not just a matter of I need to teach you how to eat right. and give you suggestions on diet, and you're going to do that because it's a much bigger picture than that.
Yeah, absolutely. We definitely function with a multidisciplinary team. So we have dietitians, we have clinical therapists, we have psychiatrists, we have medical doctors, we have nurses, we have the support people, so their family, and then the most important person on the treatment team is the client themselves.
Sure.
So definitely some goals to try to normalize their eating habits, making sure that we're correcting any sort of medical or nutritional deficiencies. But really, eating disorders aren't about food. They're about deeper psychological components. A lot of people with eating disorders also struggle with comorbid psychiatric diagnosis, so depression, anxiety, PTSD, OCD type tendencies. So a lot of the goals are to kind of manage some of those other psychiatric comorbidities. And eating disorders are usually a maladaptive coping mechanism, so a way to manage life stressors.
So you were saying, say, anxiety. So someone is feeling a lot of anxiety or stress and starts to use their eating pattern or their eating habits as a way to manage that ongoing stress that they have.
Yeah, absolutely. You know, whether it is a restriction of food intake or an overeating food intake, that is their way to manage those stressors. So whether it's the anxiety or the depression. So it's a maladaptive coping mechanism.
Okay.
So I would say probably one of the biggest goals in treatment is to establish more appropriate coping mechanisms, more appropriate ways to manage anxiety, manage depression, to, you know, just kind of function daily.
And so, as we know, like, you can't just take away somebody's coping strategy
Right.
without giving them something else
Right.
to replace that.
Yeah, that's why we always say that eating disorders are they're very challenging in the aspect of you can't just take away the food. You know, with someone who is struggling with alcoholism or with drug abuse, you can live your life without engaging in those substances. If someone has an eating disorder, you can't just take away the food and expect them to be able to function.
Right.
So you have to take away the disordered behavior, replace it with something appropriate, but then at the same token, teach them how to have a healthy relationship with food so that they can repair that you know, inappropriate, maladaptive mechanism with food.
Sure. So it's interesting, a couple of things that you mentioned are some of the things that we talk about in mental health first aid, right? That, yeah, probably all of us from time to time have had periods of time where we probably weren't eating in the best way or whatever, but we were still able to go to work, take care of ourselves. It didn't really impact our relationships, but I heard you say earlier that really what starts to set this aside as being more of a disorder is that it really is impacting people's ability to work, take care of themselves, and clearly having an impact on their relationships.
Yeah, there's definitely a lot of medical complications that you see when someone is engaging in an eating disorder just because it is affecting their body and they're not taking in that proper nutrition. But you know, we see a lot of people that have had to take leave of absences from school or from work, or just can't do those ADLs, those things, you know, taking a shower and, you know, being able to focus in school or to do a presentation or, you know, to have that conversation with a parent or a spouse about something challenging that's been going on. So that's, I think, what definitely sets it aside. And that's why we function with a multidisciplinary team because, you know, as a dietitian, my role is to help establish their nutrition and make sure that they're eating appropriately. And if weight is a concern, we're going to try to make sure that we get that to a more appropriate place. But I can't necessarily address all of the psychological and emotional concerns that they have. That's where the therapist comes in. You know, and the psychiatrist might be there to help with some medication management and making sure that that kind of a aspect is addressed. So that's what we do at Linden Oaks. We definitely have a multidisciplinary team. We work together on every single case that comes in, whether it's inpatient, our partial program, or our IOP program, just to make sure that we are addressing kind of all areas of the treatment so that the client is hopefully most successful when they leave.
Sure. So that's a great picture of kind of looking at what the program is at Linden Oaks. And when we come back, maybe we can touch on, you know, what are some of the misconceptions that people have about eating disorders, maybe, you know, what some family members, misunderstandings that they might have about eating disorders.
Sure, absolutely.
All right. So we'll be right back to talk more with Megan.
It begins innocently enough. You don't return a phone call. You break a date at the last minute. But in fact, it's the beginning of a pattern. And soon, your friend with mental illness realizes you're avoiding them. But what if you knew that your friendship was the key to their recovery? Would you still lock them out of your life?
Real men know that getting tested is the way to take care of their families. That's why real men wear gowns. For a list of the tests you need, go to ahrq.gov.
Welcome back to Mental Health First Aid. We've been talking with Megan Raupp, who's an registered dietitian with the inpatient program, eating disorders program at Linden Oaks. And we were kind of talking about just understanding overall what the treatment program was for eating disorders at Linden Oaks. But we kind of wanted to find out, so what are some of the misunderstandings that maybe family members have about eating disorders?
So I think for a lot of people, I think the biggest misconception about eating disorders is that it's all about the food. Mm-hmm. It would make sense that that's what people think because of the title too. Mm-hmm. But really eating disorders are not about food. I always describe it as food is their vehicle to kind of show their distress in life. Whether it is the anxiety or depression that we were talking about earlier, or it's a major change in their life, parents divorcing, going away to college, some sort of experience that they don't feel that they can vocalize. Food is the way that people kind of get it out there, that tell people, hey, I'm really struggling with something. Again, whether it's restricting their intake or overeating, or kind of somewhere in the middle. So I think that's one of the biggest misconceptions about eating disorders. I think one of the other big conceptions is that eating disorders only affect females. I think that just overall mental health has a kind of a stigma for a lot of people, and I think that's why people don't get the care that they need. Mm-hmm. But eating disorders really have always been talked about as a female disorder. But luckily now we are seeing more males getting treatment, more males talking about some of these concerns, and obviously it's going to, display itself a little bit different in females versus males. But luckily there's a lot more information out there so that males are getting that help. So it's definitely not just a female issue.
And are you seeing males diagnosed with several of the different things that you mentioned, like anorexia, bulimia, binge eating disorder, all of those diagnoses?
Yeah, I would say that definitely they can have any of those. It kind of depends. Male body image is a big thing with eating disorders. So for females, a lot of the times it's wanting to change and get smaller or lose weight or manipulate in that respect. For males, a lot of the time, the concern with body image is actually trying to get larger, so more muscle mass, that type of thing. So you can have males diagnosed with any of them. Luckily, with the change in the Diagnostic Statistical Manual, which is what we use to kind of diagnose everyone, in the 5th edition, which just came out, there have been changes to the criteria for anorexia, especially, so that males can actually be diagnosed with anorexia. Previously, they couldn't actually be diagnosed with it just because of some of the specific criteria listed. So we definitely see it with, across the whole spectrum. And I think too, what we're seeing now is, eating disorders were always believed to affect young, adolescent, white females, Caucasian females.
So then it wasn't even looked for in other populations, probably.
It was thought to just be a young, Caucasian, affluent disorder because, again, if people think it's about appearance or vanity, that kind of fit that mold. Whereas now we're definitely seeing it's very multicultural. There's differences with food in cultures, with religions, genders, ages. So it's definitely not as specific as it was once thought to be.
So, I mean, you're kind of talking about, how people kind of view it as, it's just a problem with eating or whatever, but you were describing it as being, it's a way that the person is kind of trying to show people that something's not right, or I'm feeling unwell in some way, but I'm not able to verbalize that to you or explain it to you. So one of the things we talk about too in mental health first aid is helping people to recognize signs or symptoms of maybe what some of the common mental health disorders are. So what would be some of the indicators or signs and symptoms that someone might be experiencing an eating disorder or starting to go in that direction?
So the things that people are going to notice mostly are going to be their eating habits and their body. So a major shift in weight, whether it is down or up,
Okay.
could definitely be an indicator. You know, a change in their food preferences. So, you know, we have parents that say, you know, Johnny, when you were younger, you used to eat, you know, all of these different foods that I make, and now you won't eat any of them.
Okay.
You know, or someone whose food choices have become very restricted or very limited, or who seem to do kind of weird things with food. So they have to eat only at specific times, or they can only eat food prepared by them or bought at one specific place, or they're combining weird, you know, kind of foods that someone might not normally think as, you know, a normal food combination. So a lot of changes with food. A lot of the times too, you'll see with, you know, which is common with maybe some depression or anxiety too, becoming more isolative, people kind of withdrawing from their social circle, a lot of medical complications as well, low fatigue, or low energy, just not really being able to be as excited about life or excited about different things.
Will people sometimes present at the, say, primary care physicians' offices for some of those other medical issues kind of thing?
Yeah, absolutely. I think that's one of the reasons that eating disorders are somewhat misdiagnosed at times, or missed, is because if someone presents at their primary care physician with some GI stuff, so, you know, a lot of bloating or uncomfortableness, or having a lot of acid reflux, or, you know, a change in weight, but a lack of appetite and feeling nauseous, you know, to someone who isn't familiar with eating disorders, that sounds like there's something, you know, gastrointestinally going wrong.
Right.
Or maybe you have a virus or a bacteria or something like that. What's often missed is that motivation and intent, you know, dealing with food that can cause those symptoms.
Sure.
You know, or for females, for girls who whose menstrual cycle is interrupted, there may be some other concerns with that, but again, you kind of have to investigate and figure out what else is going on so that you can kind of pinpoint.
Sure. Sure. So let's say a family member or a friend notices some of those things. What should they do, or how could they approach the person that they're concerned about?
So I think this is always a hot topic, but also a really confusing topic for so many people, because, you know, if you notice something, talking directly to someone about it could be really helpful, but it could be kind of scary and detrimental at the same time.
Right.
So, you know, what I always recommend for people is, number one, if you have a question or concern, is addressing it in a very compassionate and empathetic way. When we talk about eating disorders and we know that it's, you know, using their body or food as a way to kind of voice what's going on, you want to make sure that you understand that there's something else going on, and to be very compassionate. But there are a lot of resources for people too. Linden Oaks has, you know, it is now the ARC, so it's our
Assessment and Resource Center,
yes,
right?
so our assessment, it used to be a different name. So our Assessment and Resource Center, so people can call at any time, 24 hours a day, to kind of like a hotline, you know, to have assessment questions, or to, you know, ask what the next steps are. They can have referrals.
So let's hold off and kind of come back to that in a minute, in terms of just, you know, how people can respond. So we'll be right back after this break to find out a little bit more about resources and how to help.
The first step to getting into college is finding someone who can help. For the next steps, go to knowhowtogo.org.
Everyone has friends. There's online friends, friends to go out with on a Saturday night, friends to hang out with and do nothing, friends who show up on moving day. And then there are the friends who'll be there if someone is dealing with a mental illness. Are you one of those friends?
First Aid. We've been chatting with Megan Raupp, who works at the Eating Disorders Program at Linden Oaks. She's a registered dietitian, and we were just kind of talking about maybe what some resources are for family members or friends?
Sure. So there are a lot of organizations who really focus on awareness and prevention and resources for people who are struggling, or for family members, or support people who are struggling. So one that I always talk about is ANAD, A-N-A-D. It's the National Association for Anorexia Nervosa and Associated Disorders.
Okay.
So they have a website. There's a ton of resources on there.
And would the website be kind of like ANAD.org?
Yes.
Okay.
So, it's on there. There's so much information. They also have a lot of resources and referrals. So if people are looking for support groups, they offer support groups, and it can kind of look up if there are any in the area. So that's always one that I really plug. I think that's really good. And then there is National Eating Disorder Association. So this week actually is NEDA, so it's the National Eating Disorders Awareness Week.
Okay.
So they also have, I believe their website is neda.org as well.
Okay.
And so there's also a lot of information, what do parents do, how can they support their loved one, how do you know when someone needs a higher level of care,
Okay.
kind of how to navigate the whole process for them.
And that's really helpful to have good information, because we know that there's also lots of bad information online. And one of the things we always talk about in mental health first aid is use the resources that we're giving you, because unfortunately people can find out lots of destructive information by just doing a random search online. So thank you for providing those resources.
Yeah, absolutely.
Yeah. So I was going to say, we kind of talked a bit about, how do you what might be signs and symptoms if you're concerned, and how do you approach somebody. But let's like back it up a little bit and talk about maybe prevention. So how can parents support a healthy attitude or use of food?
So this is a topic that we always talk about in the program, just because so many people have a not so good relationship with food, and we know that kids up until about the age of 4, around there, really are able to kind of eat based on their own hunger cues, and after 4, they're really paying attention to their surroundings. So
interesting.
It's really important. We always stress, parents really should be role modeling appropriate eating, which can be a daunting task in and of itself. But, just if your child is in our program, they're going to have structure to their eating. So the expectation will be 3 meals, a couple of snacks, just, consistent, normalized eating. So we always ask the parents to do that as well. So, even if your child or your loved one does not have an eating disorder, modeling those appropriate eating patterns, making sure that you're eating consistently and a variety of foods, and being okay with eating at home, eating out, eating at Grandma Sally's, going to all
so
these
lots of different places, so
places.
it doesn't become sort of like this really
Limited.
ritualized,
Yeah.
limited. Okay.
Yeah, so that's probably the most important thing that I always talk to people about. And actually in our program, myself and our other dietitian and our other staff will eat with the patients. Because
that's part of the modeling.
That is part of the modeling, yes. We don't have eating disorders, but we always still recommend that people are eating regularly and appropriately. And I get my patients that ask me all the time, Megan, what do normal people do? Do normal people eat like this? And I always tell them, yeah, that's always the recommendation. Even if I'm working with someone who doesn't have an eating disorder, this is still their recommendation, that they're eating appropriately, regularly, consistently, and different types of foods too, because then you're going to get proper nutrition. So I think that's probably one of the biggest things that parents can do to really just provide a supportive environment as their children grow up, and making sure that they have that healthy relationship with food.
So I'm guessing that sometimes one of the things that happens is that as you start to work with a patient and then make this recommendation to family members, it comes out that there's a lot of people in the family aren't really eating very well.
Yeah. Yeah, I would say from the nutrition piece in our program, a lot of it is family incorporated and family education as well. Because if you have a 12-year-old in a program, I would assume they're not grocery shopping
Sure.
and preparing the food and eating the food by themselves. Usually it's a family occasion, and we really do stress family meals. Not only is there a lot of research in improved cognitive function and grades in school with kids who eat family meals, but they're also just overall in a better health state. So,
Sure.
Less incidence for heart disease and,
Right.
they're just overall more healthy. So really family meals is definitely stressed too, not just that they're modeling, but that they're eating together as well.
It's one of those, creating a lot of those protective factors
Yeah,
for
absolutely.
kids.
Yeah.
So what about in terms of sort of like fad diets? What happens if your adolescent comes home and is like, I'm going to try this, new diet that my friend is on? What are some of the ones that you hear about, or how do you handle that?
Yeah, so we definitely live in a diet lifestyle mentality, and that's probably one of the biggest challenges that we face, as a dietitian, really trying to help people work through that. We do not encourage diets. We don't encourage diet products. We really try to negate that diet mentality because, again, we're trying to promote a healthy relationship with food. And when someone is following a diet, typically it is to manipulate their body, to manipulate their weight, their food intake for some other reason. Anytime you're doing that, you're really not creating a healthy relationship with food. Again, you're using food as a vehicle to kind of change how you feel about yourself or what people view you as. So we really often have to talk to family members and friends that, there's a lot of diets, fads out there, nutrition fads, whether it's, the paleo diet or the master cleanse or juicing, or, I could talk for hours about that. There's just so much information out there. How do you kind of navigate, and what is the recommendation? And so when people ask me, Megan, what's your ultimate diet? What is your go-to? I always tell them it's kind of boring, but it really is just consistent eating. 3 to 5 times a day you're eating a meal or a snack. You have all of the different food groups at each of those times. You're eating a variety of foods. You're not just limited to a narrow list of foods that you're willing to eat, that you incorporate healthy exercise habits and healthy sleep habits, that you're hydrated. That's kind of my go-to.
All right. So pretty basic and simple.
Yes.
Right?
But still challenging to uphold.
Yes.
Absolutely.
Yes. So this has been very interesting. I really appreciate you taking the time to be with us today to talk about the Eating Disorders Program. And again, helping family members recognize and hopefully prevent, right, eating disorders by encouraging, healthy habits. So thank you, Megan, for being with us today. Thank you for joining us on Mental Health First Aid. We look forward to being with you again next time, and in the meantime, be well.